Bulldog and the Rude Awakening Show.
Just like any good doctor, right on time. Dr. Ed Dougherty in the studio with us. Good morning, Doc.
Good morning, Bulldog. How you doing?
Good, how are you?
Real good.
What, did you go grocery shopping before you came in?
Yeah. Still made it on time. I thought you might want something to eat.
You are something else. Well, I was going to be nice to you anyway. I like you. I mean, you didn't have to bring all that.
Oh, well, then don't eat it. I'll take it back.
All right. A lot of you guys know Dr. Dougherty from Delmarva Sedation Dentistry.
Right.
Which I guess you could explain what that is.
It's a practice that's geared towards putting people to sleep so they can get through their dentistry.
Okay, now we're going to do that to you today, Coach. Doc, just eat
Needle
those,
me up. We'll do
eat
whatever you
those
gotta do.
donuts.
You mean I should have left the food and brought my drugs?
Oh, yeah. Absolutely. How did you get into this? I never really asked you. How did you start?
It all started from surgery. Some of the surgeries we do, the advanced surgeries, people really need to be asleep.
Okay.
So we're putting them for that, going in their sinuses, rebuilding their jaws, putting in implants, major reconstruction. And in the process of doing that, this is many, many years ago, some of the patients said, well, I don't need that kind of work. I like the fact you put somebody to sleep. Could you do that for me? And I said, sure, no problem. And then one led to another, and I didn't realize, well, we do realize as dentists that we're not the favorite place for people to go.
People say that, but well, I disagree, but that's just me. I love you. How often do you see me over at Atlantic Dental? I'm there like every week.
Every week, every day. You come by, say hi to Terry, and you're on your way.
You told me you go for the lollipops.
I go all the time. I mean, really, it's good.
Sure,
Yeah.
the paraffin and all that.
Yeah, like the hand treatment.
Yeah, so one thing led to another. And then I realized about 70% of the population really hates going to the dentist.
Okay.
And you don't realize the magnitude of it until you start dealing with that set of the population. And also my practice gravitated towards that. So half the time I'm in surgery, and the other half the time just taking care of people for their regular needs, but just can't make it through without a little bit of help.
All right. So, and you started this, where did you begin doing this?
Originally in Washington, D.C.
Okay.
Before that, I was up in Baltimore, hospital up there, Johns Hopkins, and I was on their staff there. From there, I went into private practice in Bethesda, and my wife and I had a home down here where we'd come to visit, and then we started visiting it every month. Then it was every week, and we said, let's get out of Washington and move to Ocean City. And so we did. So about 3 years ago, we moved on down here and love it.
All right. Well, we're glad you're here. I know a lot of people are glad you're here, especially those who don't, like to go through their dentistry with feeling because you feel nothing.
Yeah, and I'm getting to meet the shore very quickly, which is nice.
Well, that's good. Now, you also just came out with a book.
Yep.
Contributing to the Inside Job.
Yeah, a doctor out of Massachusetts contacted me and asked me if I'd write a chapter on sedation dentistry and the impact it has, and said I'd be more than happy to, and it just got published last week.
That's exciting. Yeah,
it is exciting. Actually, we went to the search on Amazon, and it seems that in oral pathology and hygiene and whatnot, we zoomed up to #1 seller in that little category. So
oral hygiene and
oral pathology and dentistry in general. So we kind of zoomed to the top in that.
Well, there's a lot of information in the book. I mean, there's a lot of different things with this. Yep. Your chapter is
just on sedation and fear, and then there's some. Every aspect of dentistry is covered in the book by one doctor. Yeah.
Do you know a lot of these other guys? Or?
I don't know any of them.
Oh, really?
All contacted independently. We've never met the group before.
These are the world's leading dentists. That's who it is. You're part of the world's leading dentists.
It's nice that someone said that.
Sure.
I'll buy him coffee and breakfast too.
Yeah, my God, what did you do here? Look at this guy.
Well, the Harris Theater had some nice stuff, so we got some sandwiches, some donuts, a little coffee, a little Starbucks. That'd make the morning go easy for you.
Well, of course, that's what you do. You just make things easy.
Yeah.
Just make things easy.
Yeah. But fortunately, I didn't bring my other stuff with me. I could have put you to sleep today, but then, people listening on air going, why isn't he talking anymore?
I was going to do this. Actually, we were talking about this, and I may have you there because I might have to get some teeth out. Right. And if I do, I would be sedated.
Of course.
For sure. I mean, does everybody get sedated now when they get teeth out? Or how does that work?
No, a lot of people still don't, but the majority, yeah. If you're going through anything major, Why stay awake?
Why? Because and then you don't feel anything.
You don't feel anything. You don't remember anything. The event just occurred without your knowledge, and there you are.
So I had talked to Dr. Dougherty about it. I said, well, wait a second. If I do this, I should make this part of the show. I'll have Coach there, and he could be recorded. Because you could talk, though, right? Like, isn't there a stage where you're still...
Yeah, very minor stage. You're dropping off quick.
Okay. All right. So, but there is a minor stage. I don't want to talk to you. Forget it. Because what was that sodium pentothal? Now, that's not... Is that that's different?
No, that isn't used anymore.
Oh,
that
used to be
was the
used.
old truth serum. That you'd chatter away. No,
yeah.
This stuff you're going to sleep.
Okay, so you're out. All right. Because I was going to say, if I took the other stuff. Now, had you ever done that? Like in your training and your practicing sodium pentothal, or was already done?
That's done.
Okay.
Well, no, in the early days we did it, but that hasn't been used in a long time.
But you can still get it, right?
You can still get it.
Yeah, but it's only used. It's only used for
Sodium pentothal.
So order some for Bulldog.
Put it in the air conditioning vents.
No. Because if people do that though, I mean, you can't lie. I mean, that's truth serum.
Well,
Or
you tend to
supposedly.
talk a lot.
Yeah.
Your resistance is down.
Wow, how about that? All right, so let's talk about some of the other things in this book. Again, right here, Inside Job, separating fact from fiction about your health. And let's go to your chapter. What are you discussing in Sedation Dentistry?
First of all, just about what it is, because
Okay.
most people don't even know it's available. We ended up putting a little sign up on Route 50, billboard there, saying dental fear, and people are calling, going, "What's this all about?" Because since it was not available on the shore before I came, and so just building up basic knowledge of this is available if you need it when you go to the dentist. So the first part of the chapter just explains that, and then it explains the various reasons why people would want to be sedated. And the number one is fear. And usually it's a childhood fear, something that came early on in life for whatever the reason, whether it's real or imagined. So many times you hear the story, the dentist had his knee in my chest, and no.
They don't really do that.
They don't really do
No,
that.
they don't.
But the child's perception lives with them forever.
Well, I have to blame my mom. My fear of cane, and I'm not afraid, obviously not now, but I went to a dentist, never had Novocaine until I was 16 years old, and just never had it. And we used to have to pedal to make the drill go. No, okay, maybe I'm lying about that. But
A little stretch.
But for honestly, we used to go up to this guy, Dr. Besman. I remember this guy. It was real far out of the city. It was like an hour. And we go to, I'm like, why are we going to this guy? He's like Mengele. And my mom, I'm like, stop it. And it was awful.
Yeah,
and
the Little House of Horrors.
Yeah. It looked like a little house of horrors. And he used to drill it, and stop complaining. I'm a little kid. Do a lot of people today use no Novocaine, or mostly people?
Almost everyone uses Novocaine.
You've got to be crazy not to.
Of course. And with kids today, they actually make it fun to go to the dentist. So I think a lot of the childhood fears are going to disappear on down the road. But yeah, a lot of people like yourself never had it, and so they
how about you when you were growing up? Did you have Novocaine?
Not till high school. Before that, yeah. You kind of gripped the chair. See
Yeah.
how far you could sink into the back of the chair, see
it
if
was
you could
awful.
run away. Yes.
It was 16 years old. It was the first time I ever had it.
Yeah.
Because I was allowed to go on my own. I had a car.
But that was standard of care at the time, which it is no more, fortunately.
Yeah, good.
So fear is number one. And,
Okay.
the average patient coming in with fear is probably, largest group is in the 3 to 7 years since their last visit.
Okay.
10 to 20 is not uncommon. Over 20 to 30 are fewer patients. And I guess the longest time in between visits is 50 years, where he got traumatized as a child. And then in his 50s, he showed up and he says, I have some dental problems. Well,
You would think so.
After 50 years, you would tend to think so. But that's not uncommon. And the longer you stay away, the bigger the fear gets, and the monster in the closet just seems to grow and grow.
Gotcha.
Until you face it, and all of a sudden you go, I can make it through this now. So that's number one. The second reason people come, a lot of people have a strong gag reflex. And while they can eat and drink and all that, no problem, you start to put instruments in their mouth, this isn't so good. And they have a little x-ray device. So some of them need it for that. Others say that they can never get numb. Well, you can get numb, the drugs do work. But there may be a perception there that you're still feeling something. And if you sedate those people, you get them past that sensation and fear.
So but that is, because I've heard that, but everybody can get numb.
Everybody can get numb.
Okay.
There are a multitude of drugs and different injection techniques, but eventually you will get somebody numb.
Gotcha.
Whereas if they're asleep, it's a much easier process. And then there's some people that just can't make it because of physical, mental handicaps. Pardon me. And for them, it's a whole lot easier to be asleep and get through the procedure.
Gotcha.
And then our last ones are I think the most unfortunate ones we have. Some people have been subjected to sexual abuse, and the idea of lying down in the chair and having some stranger work on them is less than appealing. So for sedation for them is highly valuable. So all these 5 categories are generally most of the patients coming into the office, but the number one is just plain fear.
Well, it makes sense. And I'm like you said, everybody on the shore is meeting you now, so they know you now.
Yeah. Come on by.
I think you're a very personable guy. First time I met you, I didn't know who you were, and we was talking. You're a big traveler and a diver, and you right?
Yeah,
do a lot of stuff like that.
I'll be diving in a couple of weeks.
Yeah.
Down near your old territory.
Where are you heading?
I'll be in Bonaire, in the lower Antilles. You were in the upper Antilles.
Yep, that's way down.
Yeah.
Nice place though.
Oh, it's a good place to dive.
So tell us more about Ed Dougherty. You dive, and what else?
Private pilot.
Oh, yeah?
I like to fly. I hadn't been up in a little over a year. I've been busy with the practice and all that. Yeah, flew out of Salisbury and flew out of Georgetown up in Delaware.
Okay.
So a lot of fun, small planes, but it's great seeing the shore from the air.
Oh, yeah, it's always fun to see it from the air.
Yeah, and my wife and I like to go out on boat, fish a little.
Look at that. What a guy. A regular guy.
I don't catch anything, but we fish a lot.
Hey, you're out there.
Yeah,
That's what counts.
We're out there having a good time.
Yeah, no, I'm curious.
Pretending.
When you started flying, was this in the D.C. area when you started to get your license?
Yeah, back in the great security zones, yeah.
I was going to say, that's got to be a really hard place to fly.
You keep your wits about you. You make a mistake, and all of a sudden they suspend your license, and you're in all kinds of trouble. I've seen the Black Hawk helicopter take a few planes, guide them into Frederick Airport,
really,
out of the area, for minor violations, but for that person, it's a very bad day of flying.
Oh, yeah. I mean, I could only imagine what that's
terrifying.
like. I mean, when I took flying lessons, I took a small, not O'Hare, but Midway Airport, which is still big enough.
Sure.
And they would put you, I was on a little Cessna 172,
Yep.
and they would put you on a runway behind like a 747. It just was very intimidating.
Yeah, let's see if we can flip this plane.
I'm like, I don't know if I want to be here. I'll stay way back. So that's interesting. You're quite an interesting guy, Dr. Dougherty, and congratulations on this book. Where's the best place for people? Is it available at Atlantic Dental? Do you guys have
that we do.
copies of it there?
Yeah, we have plenty of copies there.
And you get signed copies.
I'll give you a signed copy, absolutely, positively.
And like I said, there's other things you can learn about the world of dentistry. It's all sorts of things.
Yep, and good topics, basic restoration, cosmetics, implants.
What is now in all the years you've been doing this for a long time? What has been the biggest advancement that you've seen, like as far as cosmetic dentistry?
Well, the two biggest things are cosmetics and the surgery.
Okay.
The fact that people can lose teeth and we can actually restore them back to just as if they had teeth again, without the use of dentures, bridges, and everything else.
Are dentures a thing of the past? Is that like we don't use dentures anymore?
No, well, we still use them.
Okay.
But even for those that have them, they can be better anchored, more secure, more comfortable with implants. You attach them to the denture, and all of a sudden they're very stable in there.
Okay.
But for those missing a few or all of their teeth, dental implants is the way to go because you're functioning almost back to normal, which is fantastic. In cosmetics, today, everyone can have the Hollywood smile. I mean, we turn on TV and you see all these absolutely perfect teeth staring at you. They weren't born that way.
Really?
No.
Oh, I didn't know that.
Thank their local dentist. That's what it is.
But you're right. Everybody in Hollywood.
Yeah, which is now become the standard.
And what is that? What do they call it?
A veneer.
Yeah. And you just, I think I'm going to go get them done. I'm going to fill in my gap. But my son told me I can't. He goes, that's your personality. So I'm keeping it. Me and Michael Strahan.
Sure. But no, the other doctors there at the office, myself, all went out to the LBI Institute, and we studied out there, and it's a great place to learn cosmetics. So I've been doing that for years and years.
Very good. Well, I'm sure, and that's just going to keep going and going as far as the advancements. They're never ends.
Yeah, why should you not have the perfect smile when you look at somebody?
Sure. Yeah, have a perfect coach. Because
Let's
he's got
see
because he's got those little baked bean teeth.
It's all the meth I do.
Yeah, now that's something. Meth mouth.
Yeah.
Ooh, that's
That's an ugly repair job.
That's got to be an ugly repair job. I mean, I didn't know it did until I was watching shows and they showed that one day. Like, why would anybody subject themselves to that?
Yeah.
So what? Give me. Is there a tip out there, people, for better teeth? You know, what's? Give me a good dentist tip now.
The good dentist.
Yeah, let's floss, brush,
Floss, brush, routine daily care of your mouth by yourself, and you probably never need dentist.
Well, don't tell them then; they'll put you right out of business.
We tell them that every time they come in.
They don't listen to
Do
you.
people listen? No. They go home, hey, I'm going to start flossing tomorrow, and then they quit 2 days later. Yeah.
Man, I'll tell you, my wife, whatever you guys told her, she goes through a ritual. Takes her about an hour and a half now to no, I mean, seriously. She has been so good.
Through 2 TV shows and you still on your way.
Yeah. It's like if I don't hear that floss pop out of, hey, is that not part of the show? No, she's real good about it.
No, but reality is,
Yeah.
if people put 5 minutes a day in, they really don't need much chair time. You can prevent most of the problems.
Only you could prevent dental problems. All right. The book is Inside Job, available. Just look up the title Inside Job or look up Ed Dougherty. What do we?
It's available at Amazon, also available at Delmarva Sedation Dentistry. Just come on by and get a copy.
Okay. They're right over there in the Gina Renee Piazza.
That's it.
All right, Doc. I appreciate it. And, I'll be seeing you very soon.
Looking forward to it, Bulldog.
All right. Thanks again.